Today we'll go over some frequently asked questions about gestational diabetes management. Gestational diabetes is a type of diabetes that some women develop during pregnancy due to changing hormone levels in the placenta. The pregnancy hormone make it hard to make enough insulin. Insulin is a hormone that helps the body put glucose away in the cell. If the body cannot make enough insulin, blood sugar will rise. It is not good for mom or baby to have too much glucose in the bloodstream. Eating healthy, staying active, testing blood sugar, and taking medication in some cases can help keep mom and baby healthy. It's important you keep testing your blood sugar daily as fluctuating pregnancy hormones can affect blood sugars. Test both before the meal, so before you start eating, and 1 hour after that same meal, so 1 hour after the last bite. For example, one day you test at breakfast, the next day you test at lunch, and then the next day you test at supper, and the following day you test at breakfast again. Sometimes we'll ask you to test more frequently depending on your blood sugar, so we can closely monitor your blood sugar as needed. To ensure your meter is working properly and giving accurate results, you will be asked to take your meter to the lab and compare blood sugar readings from your meter to the lab's meter. The tests need to be done within 5 minutes of each other. A small difference in values is normal as long as the value your meter gets is within 15% of what the lab gets. Start using your meter right away. You will hear from our clinic if your meter is not accurate. If you do not receive a call from us, your meter is accurate. Here are some tips to help with high blood sugar after meal. Keep your starch portion to 1 cup or less at meals. Choose low glycemic index carbs. These are slow absorbing and you don't see a big rise in your blood sugar after eating. Include veggies and protein at meals, and eat more of these low-carb food if a smaller starch portion leaves you feeling hungry. Be sure to eat snacks in between meals so you are not as hungry going into the meal. Snacks help prevent overhunger, bigger portion, and racing later in the day. A short walk or activity 10 to 15 minutes after meals also help regulating your blood sugar. Here are some tips to help with high blood sugar before meal. For the before breakfast blood sugar, or also known as fasting blood sugar, have supper before 7 if possible, and for 20 minutes or so of activity in the evening. It could be a walk, prenatal yoga, or exercise video. Have a nice snack 1 hour before bed with 15 to 20 grams of carbohydrate. For the before lunch and before supper blood sugar, have a snack only for 15 grams of carb if meals are over 4 hours apart. Try to have at least 2 hours between the snack and next meal. Be sure to include protein at each meal and snack. Sometimes blood glucose level can continue to be high even with healthy eating and activity. This is a sign of insulin resistance, and you may benefit from medications to help manage your blood sugar. It is important to follow your meal plan and the suggested carbohydrate target. Do not cut back too much on carbohydrate as the baby uses them as its main energy source. Make sure you are eating according to the suggested meal plan. The best strategies to keep your blood sugars stable and you energized are: eat 3 meals a day, add snack midway between meals if meals are more than 4 hours apart, combine protein with carbohydrate at meal and snack, and choose carbohydrate food that have low glycemic index. If you are still hungry, then choose larger portion of protein and unlimited portion of non-starchy vegetable. Late or overnight shifts can affect your diet and sleep. Plan healthy meals and snacks to manage blood sugar, boost energy, and improve sleep. Follow these tips. Eat every 3 to 4 hours with 3 meals and 2 to 3 snacks. Avoid large meals late at night. Stay hydrated but limit caffeine at least 6 hours before sleep. For overnight shift, have the biggest meal at supper around 5:30 to 6 p.m., a light lunch at midnight, and a light breakfast before sleep. Include a snack between meals. Enjoying a treat occasionally is okay. Here are a few tips to consider when having a treat. If you have a treat during a meal, consider having a smaller starch portion to stay within your carb target. Use your blood sugar result to make adjustments. Being active after having a treat can help regulate blood sugar. Opting for low-carb version of your favorite available at grocery store or through low-carb recipes. However, be cautious about replacing nutrient-rich foods with treat, as it may have implications such as compromising overall nutrition. Water is the best choice for staying hydrated and keeping blood sugars in target. If you are looking for more flavor or an alternative to water, try these options. Add a few slices of fruit like cucumber, lemon, or lime to water. Sparkling water. Liquid flavor enhancer. Add to water. Use the minimal amount needed to flavor. Decaffeinated coffee or tea, hot or ice. Unsweetened almond milk. Diet pop. Limit artificial sweetener to 2 servings per day. Keep your caffeine intake to less than 300 mg per day, which is about 2 8 ounces or 250 milliliter cups of coffee. Sources of caffeine include coffee, tea, pop, energy drinks, chocolate. Decaf coffee and tea have negligible amounts of caffeine. Some herbal teas are considered safe when limited to 2 to 3 cups per day. For example, bitter orange, orange peel, echinacea, peppermint, rosehip, rosemary. Avoid other herbal teas as their safety is unknown or have shown potential risk in study. If you have any question or feedback, please feel free to email or call us.